Hey, welcome to Module 1. I'm just going to go over the formatting of the book with you real quick, give you some pointers on how to study for these quizzes that you're going to be taking, and just have some fun. All right, the first thing to look at is our learning objectives. You have some in the textbook, page 1, and you also have them under your modules in Canvas. This just tells you kind of what to expect from this course. You need to know what the role of pathophysiology is in diagnosing and treatment of your patients. We have to learn the terminology. We have to know the importance of a patient's medical history. We want to describe cellular adaptations and possible reasons for these. We want to be able to identify precancerous cellular changes, list common causes of cell damage, and describe most common types of cell necrosis and possible outcomes. Again, here are your course objectives, and you'll find them under modules. And this just pretty much describes the same things I just told you. It gives you your content here, and it also gives you learning activities. It tells you what chapters that are going to be included in this module. It tells you what to do. You have to go to the Evolve site and do the activities, read the chapter, complete the practice quizzes if you choose to, and then of course complete your module quiz each week. On page 1 of your text, it has key terms, and I've listed them here. Feel free to print this one page of this PowerPoint and write the definitions of all these terminology here. These are important terms not to just memorize for the test, but you're going to need these throughout your nursing program and your nursing career. You're going to have to know what these mean in addition to a whole lot more terminology that we're going to go over. Use this sheet though and make you start your study sheet for your exams now and write these definitions out. All right, let's look at page 2. What is pathophysiology and why do we need to study it? Pathophysiology involves the study of functional or physiologic changes that result from disease processes. With anatomy and physiology, you study the normal structure and function of the body. This course, pathophysiology, is when some disease process or injury has caused the normal physiology to be abnormal. It's some deviation from the normal structure or function of any part, organ, system, or from a state of wellness, according to your book. So be sure and look at all the boxes. These sections, these chapters for module 1 are pretty short. So always in nursing programs, we really like boxes. So look at box 1.1 on page 2, 7 steps to health. So why would we want to identify healthy processes? It's always easier to prevent an injury or illness than it is to treat it once it's developed. So take a look at that. Box 1.1, it's recommended to prevent disease. Your book talks about defining normal. There's averages, there's ranges. Just remember in nursing school, and I know you're not in the program yet, but just when you're discussing normal versus abnormal, if you say normal, always try to follow that with a value. The normal value of 12.4 or the abnormal value, and you list it. Don't just use the words normal or abnormal. Also look at box 1.2 on page 3, primary, secondary, and tertiary prevention. This just tells you about different stages of prevention. Primary, the goal is to protect healthy people from developing a disease or experiencing an injury in the first place. What can you think of? How about wearing helmets and seatbelts? Secondary prevention. After an illness or serious risk factors have been diagnosed, we want to halt or slow the progress of the disease in its earliest stages. We want to limit long-term disability. Something like that would be aspirin if you are at a high risk for heart attack. Regular screening exams, that kind of thing. Tertiary prevention focuses on helping people manage complicated long-term health problems, diabetes, cancer, chronic chronic pain. With this, you're going to see things like cardiac rehab centers that help people get back to as close as they can to normal after an MI or something like that, a myocardial infarction. Also look at page 4. You have a think about box on page 4. Take a look at those and see if you can answer those questions once you've read that little piece right before it. These are always, anytime they've taken the trouble to put something in a table or a box, it's important information. Look at page 4 on your medical history. Know why it's important that we get a medical history from someone. If we're going to take care of them, we kind of need to know what's going on. We need to know what their health history is, what medications they're taking, that kind of thing. On page 5, you have apply your knowledge box, 1-1. It says using the heart and lungs show how you can apply your prior knowledge of anatomy and physiology to your study of pathophysiology. What happens if we change a normal structure and predict the loss of function? Let's look at normal lungs. We know how the alveoli work. What if someone has chronic pulmonary issues such as asthma? That alveoli doesn't work as well. The mucus can get accumulated in there, and it can influence that function to the point that they do not oxygenate as well as someone without asthma. So be applying your knowledge as you go through here. Quiz yourself, look at these think about it boxes, and don't try to memorize this stuff for a test. Try to learn it. All right, page 5 through 11 is full of terminology. One of the things that it's the foundation for this course. You have to learn them. You're going to need them for your nursing programs and even, just to be in the hospital. You have to learn these terms. A lot of these should not be new to you. You've had micro, you've had A&P at this point. Anything that is italicized or blue letters, you need to know what those things mean. These pages have the term, but they also have examples. You all should know what diagnosis is. Identification of specific disease through evaluation. We're going to use laboratory tests and other tools. One thing would be diabetes. We're going to take a blood test. We're going to do a BBG. We're going to do an A1C. Those are some things that we may do. If you come in with your leg hurting, we're going to x-ray that to see if it's broken. Etiology concerns the causative factors in a particular disease. Causes of disease. Idiopathic. I think of idiopathic as, I don't know, because the disease is unknown, the cause. Sometimes a treatment or procedure can cause disease, and we call that iatrogenic. And I think of that as I caused that. Say I put a Foley catheter in without using sterile technique, and it caused a bladder infection. So those are just ways I can remember idiopathic versus iatrogenic. Look at predisposing factors. And in that, they have high risk. They talk about prophylaxis, which just means prevention. They talk more about prevention. The characteristics of the disease. All these terminology, you need to briefly know what these mean. And there are quite a few terms here. Write them down and define them. And keep going through page 8, terms used for common cellular adaptations. And it helps if you will categorize these terms so that these terms have to do with causes of disease. These are characteristics of disease. So your book uses some really good headings. Just write your notes out to include those so that you can keep them clear, because this is a lot of terms if you don't know them already. Cell damage and necrosis, ischemia, a decreased supply of oxygenated blood to a tissue or organ due to circulatory obstruction. This first thing that comes to my mind is an MI, myocardial infarction. The vessel is occluded in that little part of the heart can get ischemic and the blood supply is gone, and it results in insufficient oxygen and reduced metabolism. Keep going through to there's some really cool pictures on page 11 of some necrosis of the kidney and such. And when you get to page 12, you have a chapter summary. Look over that. You have study questions. You have answers to those in your Canvas under Module 1, and additional resources that you can look up to your heart's desire. Chapter 26 is your last chapter for this module. It is stress and associated problems. It starts on page 619, and in order to get through this chapter, you kind of need to know a lot of those terminology that we just covered. Also, in this, look at the think about boxes. I have those listed. The learning objectives, your key terms, any terminology that you see, write it down and learn it. Look at the stress response system. It's generalized or systemic, and it's in relation to a change, which is a stressor. It can be internal or external, and it can be to a specific situation. There are actually, on page 621, box 26.1, stress-related disorders. So evidence has shown that stress causes these disorders. Everybody's probably familiar with stress ulcers, and you're going to see in the hospital that we give everyone a proton pump inhibitor when they come in because of the stress of admission and the disease process. Everybody gets some Protonix or such while in the hospital now at United Regional. So look at those stress-related disorders. Read through this stressors response. Look at the think about boxes. This is a very, very, very short chapter. Go ahead and look at the coping with stress. I think this is a lot of this you've already had. It's a lot of common sense. Ensuring adequate rest. That's really probably not an option for you right now, but it is a recommendation. Look at your chapter summary, your study questions, additional resources. Go to Evolve and do your activities for chapter 26. And after you've prepared, go ahead and take your quiz.